The Tono-Pen is a lightweight, portable, accurate, reliable, and easy-to-use diagnostic instrument for the determination of intraocular pressure. Determination of intraocular pressure, or IOP, is indicated in all eyes with diffuse corneal edema, anisocoria, fixed and dilated pupils, episcleral congestion, blindness, hyphema, ophthalmos, cataracts, and anterior uveitis. In addition, animals with medically or surgically controlled glaucoma require sequential determination of IOP to ensure adequate control, and animals with unilateral primary glaucoma and breeds predisposed to primary glaucoma require monitoring of the IOP in the unaffected at-risk eyes. Intraocular pressure is normally maintained by an equilibrium in aqueous humor production and outflow. Aqueous humor is produced by the ciliary processes through active and passive mechanisms. Aqueous humor outflow occurs predominantly through the iridocorneal angle in dogs and cats, with some outflow occurring through the uveoscleral pathways. Glaucoma is an increase in intraocular pressure to a level that is incompatible with the health of the eye. Glaucoma can be primary, which is inherited and breed-related. Glaucoma can also occur secondary to diseases such as cataract, retinal detachment, chronic uveitis, lens luxation, intraocular neoplasia, and other diseases. All of these patients and ocular abnormalities require the veterinarian to be able to accurately determine intraocular pressure. Determination of intraocular pressure requires an instrument that is fast, accurate, portable, and user-friendly. As clinicians, we must feel we can rely on the accuracy of this test and make treatment decisions based on the results. In this author's opinion, most clinicians do not feel this way about the Schiot's tonometer and consequently tend not to use it. There are two specific ways to determine intraocular pressure: indentation tonometry and applanation tonometry. The indentation tonometer measures the amount of corneal indentation that occurs when a given weight is placed on the cornea. The result is inversely proportional to the intraocular pressure, and the actual pressure must be obtained from a table of values. The Schiot's tonometer is an indentation tonometer. The Schiot's tonometer requires assembly, disassembly, and cleaning in order to ensure its accuracy. The footplate is large and the patient must be cooperative in order to place the footplate on the cornea in a vertical position. If the animal is fractious or the eye is painful, then it is unlikely that accurate placement will be obtained and erroneous values will result. This author's clinical experience shows that practices with a Schiot's tonometer either do not use it or do not trust the results obtained. In many instances, pressures obtained by this method are not confirmed on referral to a specialist. The result is that glaucoma is not diagnosed or monitored accurately, and intraocular pressure determination is not performed at the frequency indicated by the breed or clinical signs. Applanation tonometry determines intraocular pressure by evaluating the force required to applanate or flatten a given surface area of cornea. The most common applanation tonometer used in veterinary medicine is the Tono-Pen. The Tono-Pen has been shown to be highly accurate across many species and a wide range of intraocular pressures. The Tono-Pen is lightweight, portable, accurate, self-calibrating, and averages several readings and gives a percentage error to ensure accuracy. In addition, the small footplate allows this tonometer to be used on painful eyes or in less cooperative patients, as only a small area of cornea is required to obtain a reading and the position of the patient's head is not related to obtaining the reading. Finally, this is the only tonometer that is portable enough to allow routine IOP determination in the equine patient. Equine glaucoma in recent years has received much attention and has increased in the frequency of diagnosis solely due to the availability of the Tono-Pen and the increase in the number of equine eyes that are evaluated. In addition, horses with cataract or equine recurrent uveitis should have intraocular pressure determined. Prior to use, the clinician should be familiar with the setup, cleaning, calibration, and maintenance of the Tono-Pen. The Tono-Pen is battery-powered with a built-in solid-state transducer and microprocessor. The batteries are installed in the handle as shown. The Tono-Pen has built-in self-calibration, and this should be performed at the start of each day or prior to use if the instrument has not been used recently. To calibrate, the activation button is depressed twice and released, which will activate the self-calibration mode. While in the calibration mode, the Tono-Pen is held vertically with the transducer tip towards the floor. Hold the Tono-Pen still. The digital window will then read up, at which time the Tono-Pen is rotated vertically with the transducer tip turned upward. Hold the Tono-Pen still until the window reads good. The Tono-Pen is now calibrated. If the unit fails to calibrate, use the compressed air to gently clean the transducer tip as demonstrated. The unit may now be recalibrated. If it still fails to calibrate, change the batteries as shown. The protective tono cover is placed over the transducer tip as shown. The cover should lay flat over the transducer tip, but not be pulled so tight as to inhibit movement of the transducer tip. Tono covers should be replaced daily or between patients with potential infectious disease such as herpes virus, chlamydia, or ulcerative keratitis. In addition, the Tono-Pen should be stored in its case with a tono cover on. The Tono-Pen is now ready to use. For small animal patients, apply a drop of 0.5% proparacaine to provide topical anesthesia. In horses, topical anesthesia and auriculopalpebral nerve block are used to achieve an accurate reading. The animal is minimally restrained. The eyelids are gently opened without putting tension on the eyelids or the globe. Aggressive restraint or excessive eyelid tension will artificially elevate the intraocular pressure and give erroneously high readings. This is especially true in the horse. Turn the Tono-Pen on by depressing the activation button for 1 second. The transducer tip is very gently tapped or bounced against the surface of the cornea. The transducer must contact the cornea at a 90-degree angle. The examiner listens for the auditory signal each time the Tono-Pen accepts a reading. The Tono-Pen will make multiple readings, average them, and calculate the standard error. The error bar should be over the 5% reading to ensure accuracy. If the error is greater than 5%, the clinician should repeat the measurements. If no readings are taken, or the examiner takes too long to obtain accurate readings, the Tono-Pen will automatically shut off to conserve battery power. push the activation button to turn it on again. When the clinician or technician has finished with the Tono-Pen, it should be placed in the protective case. The Tono-Pen can be used in a variety of species, including dogs, cats, pocket pets, horses, cattle, camelids, and many others. Use of the Tono-Pen has increased veterinarian awareness of intraocular pressure and resulted in early referral of small animals with glaucoma and a great increase in the frequency of diagnosis of equine glaucoma. The ease of use, accuracy, and comfort level this tonometer gives your practice will ensure its frequent use, increase your hospital's awareness of glaucoma, allow early and prompt referral of glaucoma patients to a specialist if indicated, and subsequent referral of your glaucoma patients back to your hospital for monitoring following laser or other glaucoma surgeries by a specialist. In addition, the Tono-Pen will allow you to incorporate intraocular pressure determination as a routine part of the physical exam in those breeds predisposed to primary glaucoma. Since primary glaucoma is breed-related, routine determination of intraocular pressure can be part of a routine wellness examination in Cocker Spaniels, Poodles, Arctic breeds, Beagles, Basset Hounds, Bouviers, Dalmatians, Shar-Peis, Chow Chows, and other predisposed breeds. In addition, given the predisposition of primary glaucoma to become bilateral, the second at-risk eye can be monitored every 2 to 3 months, resulting in early detection and prompt referral for medical and surgical intervention. Together, the general practitioner and the veterinary ophthalmologist can manage these patients better and maintain vision longer than was the case prior to the availability of the Tono-Pen.